Hi, I'm with my friend and she has a tongue thrust and chronic TMJ pain. Show us on your face where it hurts the most.
Right here.
Okay, now open really big and close. Open really big and close. Slight deviation, but not so bad. Before it used to deviate a lot. And before we started therapy, her opening was very small, and now it's starting to stretch as we loosen and tone those muscles. So first off, we're just going to start with a TMJ massage. I already did the TENS unit to help loosen everything up and help with some of the pain. So I'm going to use my fingers and just pinch them in the cheeks and just rub from the cheekbone down to the jawbone. And this part is really important just to make sure that they're breathing into their abdomen with the nose. If you find a spot that's really crunchy and tight, just pinch it and then have them breathe. Another thing you can do is pinch that crunchy spot and then have them open and close and open and close. Open and close, open and close, and then just relax now. We have trigger points here near the top of the cheekbone and then at the angle of the mandible. So we're just kind of squishing it in between our fingers and rubbing it out. And again, if you find anything crunchy or tight, or if they're wincing, just kind of hold it for a minute and make sure they're breathing deeply. You have to remind them a lot. Okay. This one is the most important one. Also, I'm really focusing on the masseter because that's the one that's the most painful. And when I teach them to do it on themselves, they need to be mostly focusing on the ropey part of the muscle back here. Right here is the buccinator, which can get sore, but most of the pain comes from back here. Okay, so first one, we're going to slide our finger up into the maxillary vestibule and push near this distal of the second molar. Slide our finger up and push towards the ceiling. This one is tender. All right, now I'm going to slide my finger up into the maxillary vestibule and relax your cheek by the distal of the second molar, and I'm just going to push up to the ceiling. It's kind of pinchy. Okay. Now we're going to slide our finger to the back of the mouth where the triangle is back here. We're going to push right in the center and push back toward the spine. And just hold it for a few seconds. Swallow. Now I'm going to go to the back of the mouth in the posterior raphe and push straight back. And I know I'm on it when the muscle starts to twitch. And just make sure they're breathing deeply into their stomach through the nose. Okay, swallow. The hard palate, scoop my finger up to this soft palate and then curve my finger up and push back there. When I start to feel the muscle twitching and jumping, I know I'm on it. This one's tender, it'll make your eyes water. So I'm going to slide my finger to the edge of the hard palate, hook my finger, push up toward the ceiling, and when it starts to throb, then I know I'm on it. And have them breathe through their nose. Yep, and I can feel it jumping. Breathe deep into your nose, into your stomach. Okay. All right, and now I'm going to find the distal of the second molar, have them bite down, and I'm going to push towards the floor as they bite. Okay. And then I'm going to push down behind the distal of the second lower molar, bite down, and then push down towards the floor. Okay, and then we're going to repeat that on the other side. Alright, so again, I'm just going to rub from the top of the cheekbone down to the bottom jaw. Right here in the buccinator and the cheek, I can feel some crunchy, so I'm just going to pinch them and have her breathe with her nose deeply into her stomach. And just pinching and sliding. And now I'm going to work my way back to the masseter. Sometimes if you have more pain on one side than the other, it means that that area is getting yanked from a deviation when opening. The opposite side is usually overly strong. And breathe deep into your tummy. So I'm working from the top of the cheekbone and rubbing down to... Okay, so first one, we're going to slide our finger up into the maxillary vestibule and push near this distal of the second molar. Slide our finger up and push towards the ceiling. This one is tender. The angle of the mandible. Swallow. I'm going to slide my finger up into the maxillary vestibule near the second molar and push up toward the ceiling. Pretty tender spot right there. Okay. Now we're going to slide our finger to the back of the mouth where the triangle is back here. We're going to push right in the center and push back toward the spine. And just hold it for a few seconds. And we're going to go to the back of the mouth, find the pterygoid raphe, just push straight back. You can feel it jumping in my fingers. Do you feel that? Swallow. Alright, now I'm going to slide my finger to the edge of the hard palate, scoop my finger up to this soft palate, and then curve my finger up and push back there. When I start to feel the muscle twitching and jumping, I know I'm on it. This one's tender, it'll make your eyes water. Alright, and I'm going to slide my finger past the hard palate, scoop it up and push toward the ceiling. This one will make your eyes water. This side's not as bothered today, it's not jumping. Alright, and now I'm going to find the distal of the second molar, have them bite down, and I'm going to push towards the floor as they bite. Okay. Alright, and then bottom, second molar in the vestibule, pushing right behind it, bite down and push towards the floor. Okay, open. I like to do this one where I just hold underneath the cheekbones with my fingers and then just have them open and close. Close, open, close, open, close. This helps them to open evenly on both sides at the same time because you're pushing on the muscles. Open and close, open, close. It can be pretty sore sometimes.
Yeah.
Same thing with this one. I'm going to hold the back of her head under the chin and have her resist me opening and then resist me closing. Resist me opening, resist me closing. And again, this just is forcing those muscles to open evenly to help with that deviation and muscle dysfunction when opening and closing. I like to do this one in the car while I'm driving, just keeping my head against the headrest. All right, thank you.